is just a huge honor for me today to be podcast interviewing Nicholas Roy, DMD, FAGD, all the way from Portland, Maine. He's graduated from the University of Connecticut School of Dental Medicine in 2007 and participated in an AEGD at the VCU, that's Virginia College University? Virginia Commonwealth University School of Dentistry the following year. Returning to his home state of Maine, he began his journey in the field of organized dentistry with a focus on continuing education. He is a member of all levels of the ADA, the AEGD, the American Academy of Implant Dentistry, a board member and president-elect of the Maine Academy of General Dentistry, past president of his local chapter of the ADA, and current president of the New England MasterTrack Program. With over 1,000 hours of continuing education, Dr. Roy is committed to perfecting his craft and sharing this knowledge with the dental community. He has a particular passion for adhesive dentistry and hopes to help steer the profession down a road where quality adhesive dentistry is a standard. During today's episode, Dr. Roy hopes to share his passion for continuing education, focusing on opportunities through the AEGD, specifically MasterTrack programs to the AEGD. In addition, he would like to share ideas with Howard on how a young dentist can advance in their career through continuing education. And Nicholas, what do you go by, Nick or Nicholas?
We'll go with Nick.
We'll go with Nick. Yep. Nick, I look back at the last 30 years, and the best move I ever made was joining the AEGD and getting my fellowship and my mastership in the Academy of General Dentistry. And if I had to pick, you always, when you look at successful people, they're always humble and hungry and have an intellectual curiosity. And I look back, and all those dentists who took about 100 hours of CE a year, their whole career, they crushed it on every level, from happiness to profitability to the joy of dentistry. And the people who took the minimum required to renew their state license, they just never seemed to be happy. They never seemed to know what they were doing. It was just a game changer. Also, you're a summary of the 5 people you hang around the most with. And a lot of these guys leave dental school and they keep their drinking buddies from dental school who hated dental school or thought, the sky's falling. But when you're hanging out in the AEGD, it's always, in Phoenix, it was always the same 100 dentists at every lecture. And so when you're hanging around people who are just going for it, it just makes you go for it. It was just so, congratulations on getting your FAGD and getting so involved in the MasterTrack program. Tell my homies what the MasterTrack program is and why it means so much to you.
Well, continuing education, starting there, most important from the standpoint that when you graduate, 20% of what you're going to, know when you retire. So, I think people forget the fact that dental school is not a grounds to teach you everything. It's a grounds to teach you how to learn. And when you graduate, the game has only begun. So the MasterTrack program helps to accelerate that by giving you the tools necessary to acquire your mastership in the Academy of General Dentistry. When I graduated dental school, I had no idea what the ADA was versus the AEGD. To me, they were the same thing. Now it's very obvious. The AEGD is the overseeing board for general dentists. The ADA oversees every dentist, whether you're a specialist or a general dentist. But the general dental field needs to have their own overseeing body, and that's where the AEGD comes in. Similar to being board certified in your specialty, the AEGD awards certificates such as the fellowship, which is the first tier, and then the mastership. And I'd like to maybe just go over what those requirements are. So your first level is your fellowship, your FAGD, which is where I'm at right now. That's 500 hours and passing of an exam similar to a board exam. Maybe a little bit more complex, more applicable to clinical practice. But it's difficult. You have to study for it. At least I did. And I found it not only helpful for my career, but it made me realize where my weak points were. Oral pathology was one area that I was glad I studied a little bit more and realized where my weaknesses were. So after you pass the exam, you get your 500 CE hours, and they're 500 hours in any discipline, and they don't need to be hands-on. You are awarded the fellowship the following year at the AEGD convention, so you do have to go to receive the award. Then you're eligible to start collecting credits for your MAGD, or your mastership, and that's where the New England MasterTrack Program has started to kind of foster that second tier level of education. And in order to get your mastership, you need 1,100 total hours. 600 are in specific disciplines, and you can go on agd.org to find out specifically what they are, but essentially fixed, removable, pedo, ortho, all of the major dental disciplines are outlined there. And then you need 400 hours of participation credits. And that's where it becomes difficult. It's hard to find a pedo hands-on course. If there is one, it's probably not in your neck of the woods. What we do with MasterTrack, at least New England MasterTrack, is we bring the speaker to us, the group that's a self-run organization that seeks out the very specific requirements of the mastership in the Academy of General Dentistry. There's 21 or 22 MasterTrack programs in the country. Ontario actually has one. So there's one in Canada also. And essentially they're all self-run, so they're all a little bit different. So I can only speak about the New England MasterTrack, but they all have the same thing in mind. Let's get like-minded dentists together, put them in a room, have them talk about how they do things, listen to a speaker, go out to dinner that night, and write everybody's bonding protocol on a napkin with a crayon. And that's honestly how I do my bonding protocol now. I had a member in my MasterTrack who actually teaches at Pankey. So there's very differing levels of dentists. It's not just young dentists. It's dentists from all walks of life. I had one of these instructors from Pankey teach me his bonding protocol on a napkin with a crayon. And honestly, it's more about the networking and discussing the frustrations of a practice with the people within the track itself, in addition to what you're learning from the speakers that come in. And we bring in speakers, that are maybe not top tier, but second tier. We have Mike Malone from LSU. I mean, you're getting clinicians that have been talking about dentistry for 20, 30 years. They're often affiliated with a university. They've mostly published. So what you're learning is state-of-the-art and very sound information. So, not all CE is created equal. What I consider about MasterTrack is that you're really taking classes with people that are at that next level, that really enjoy learning and advancing their career.
Well, I put Mike Malone in tier 1. He's down there in Lafayette, Louisiana, and Jerome Smith and Danny Dominique and placing implants. I mean, those guys are just, you can be anywhere. You can be Kansas, Lafayette, Louisiana. Mike Malone is amazing. And you're right, the AGD is for general dentists. The ADA, I see the AGD for educating general dentists. I don't really like the term general dentist. I like family practice because that's kind of what the consumers call it. I've never been called a general dentist from a consumer, but I often hear them say, family practice, physicians, family practice, general dentists. But the ADA is more about politics. And you're right, there are representative to Washington, D.C. and the 50 state governments. I see them as a political lobbying play, and someone's got to be up there on Capitol Hill fighting for our rights, or dentistry can, that's the only thing fighting for us politically. But you're right, the ADA is made up of a lot of specialists, and a lot of these kids just walked out of dental school with $350,000 in student loans, but since their dental school has grad programs in endo and perio and oral surgery, they didn't get to do anything. I mean, they were basically left with the fillings and crowns and cleanings. And I tell young kids, if I was going to pick a dental school, I'd look and see what grad programs they had. And just remember, if they have a grad program in that, you're not going to learn anything. They're going to funnel all those patients there. And so, you know what you know. There's known knowns, and then there's known unknowns, like what is dark matter and all that. Then there's unknown knowns and unknown unknowns. These kids are walking out of school. They don't even know what they don't know. And if they joined this MasterTrack program and the first 5 years knocked out 500 hours of continuing education, I mean, they have no idea what that would do for their career. I mean, how do you get that into their head? Because at that age, when you're 24, I mean, come on, you know it all. And your dad and grandpa are the two stupidest people on earth. So how do you convince a know-it-all 24-year-old that they just walked out of dental kindergarten?
Very, very difficult. I just got done a round of interviews for an associate position, We have a new dental school up here in Maine, University of New England, and we just graduated the inaugural class. And it was amazing to me the confidence that these guys had. Now, they do not have specialties, so there's no post-grad programs, but they were extremely confident. I think overly confident. I can't say I wasn't that way, so I'm not knocking them. But what I will say is we really need to foster their learning as experienced dentists. I've been doing this for 10 years. I still think I don't know what I'm doing. And as every day goes on, I realize that I'm more clueless than I was the day before, not, the other direction. And I think it takes a few years to get these under your belt to really understand that. What MasterTrack does is you're surrounded by dentists that actually do know what's going on. They can speak about experience. And ultimately, you're given homework assignments. You're having to do some flats, which maybe some dental schools don't really prepare kids to do. Doing suturing techniques like a horizontal mattress suture. I mean, I learned that through MasterTrack, and it's critical to everything I do every day now. I think just the experience of the people in your class will kind of shed some light on really what's going on in dentistry, and that none of us know what's going on, except for you, Howard, of course.
So why? So what did the locals? What did all the dentists think of Maine building its Northern New England's first college of dental medicine? I remember I came out here in '87, 30 years ago, and there were no dental schools. And when they tried to open up the AT School of Oral Health Dental School in Missouri, I mean in Mesa, Arizona, the local dental society was not happy. And then now there's two dental schools. No one wants competition. They always say they do, but they never do. How was that getting a dental school in Maine, its first one?
I think it was embraced 100% by everybody in the area. Maine is a very large state. There's a lot of pockets that don't have the people in those areas don't have access to care. Portland area, we're a saturated market like many metropolitan markets are. But really, what we're hoping is that not only the students that will be treating these areas, it's a model that was taken after Arizona, in that their third and fourth years, they're not in a clinic in the dental school like I was at Connecticut, but they're going to be out practicing in practices with dentists that want to teach. They'll be in public health centers, FQHCs, different areas where the need needs to be fulfilled. Now, whether the dentists end up setting up practices in these areas is yet to be determined. But we have 60 students every year, 120 total, going out to areas all over northern New England. It's not just Maine, it's Vermont, New Hampshire. So there's quite a big need being met, and I think every dentist that I've talked to has embraced the idea. I haven't heard any opposition whatsoever.
Well, you got to sell your practice someday. So if you're not making any new dental students, there's not going to be anyone to take over your patients and your practice. I mean, you got to think beyond. So where is it actually at?
In Portland, Maine.
The dental school's in Portland, Maine?
Yes.
And do they serve anything in the cafeteria other than lobster, or do they just only eat lobster?
Lobster and mayonnaise. So you can have it fresh or just a lobster roll.
Those are the two food groups in Maine?
Yeah, potatoes and maple syrup are for dessert.
Again, I mean, it's just, you're a dentist. You think that the number one thing you'd have to get right is the dentistry. I mean, if you're a dentist and you get everything right but the dentistry, that's not what you build on. You build on first being a dentist. And I also think, when you're first 5 years out of school, you think you're so good because it takes 5 years for stuff to fail. And then you realize, that big, huge monster post and on an anterior tooth sheared off of the gum line, and you were able to do a root canal on the post, and there was no ferrule, and you got the whole tooth back. It takes 2 or 3 or 4 years before the patient walks back with all that crap in their hand, and then you're thinking, okay, what is a ferrule again? By the way, you know where the word ferrule comes from?
I do not.
So they learned that with barrels, that where you're making barrels, if you just had like a little 2-inch ferrule around the barrel, and a more expensive barrel would have maybe one in the middle and one on the top and bottom, but that little they learned that little metal ferrule around the barrel made the barrel immensely stronger. Just that little 2-inch strip of ferrule on this big 50-gallon barrel was all the strength. And you were telling me your last name, Roy. You were. I never knew the meaning of Roy. Tell them what your last name, Roy, comes from.
So Roy comes from a French background. Roi is how they pronounce it, at least in Canada, and it means king in English. We have a couple ways to say it around here, but essentially Roy means king, and corduroy pants, is actually the cord of the king. So corduroy pants came from the specific pants that the kings wanted to wear back in the day, and that was a luxurious pant. Now it's not, but that's where the origin.
I got to tell you something about Ryan's grandpa. He was in his formative years, he was through the Great Depression, and everybody was so poor, the only thing you could afford was jeans. And so when he made it and he became successful and he opened up a machine shop and was successful, he never would wear blue jeans the rest of his life. He only associated blue jeans with the Depression, and corduroy is you made it. And that's all he wore was corduroy pants. And then when he was looking at himself in the mirror, he was seeing a king. And
Okay.
and when he saw kids, and I'll never forget when they started selling jeans that were pre-washed and torn and messed up and everything. And I mean, he would just shake his head like, unbelievable. These kids don't even know how dumb they look, because he was from the Depression.
Maybe we could resurrect the trend right here. Corduroy are the new stonewashed jeans.
So why is adhesive your gig? Why did you, of all the things to get enamored with, why did you get turned on by adhesive dentistry so much?
At UConn, they taught us how to place amalgams, and I went to my residency, and at VCU, they're much more forward-thinking, and composites were the primary mode of restoring teeth. And I had a hard time with it because I was told that amalgams last longer. And then you get out into the real world and you just see amalgams that are 50 years old, but a composite next to it that was placed 5 years ago, and the tooth now needs endo, crown lengthening, post-core, and crown. So to me, it was just obvious, and I just kind of see how markets sometimes force the new thing to become the standard. And I'll be honest, to this day, I don't place amalgams, but I do understand that, maybe in third world countries we should still be placing amalgam or glass ionomer. But here in the United States, we should be providing top-notch care to the point that if we're going to replace a treatment, that replacement has to be better than amalgam. And I think it can, but I think it's very difficult. A monkey can place amalgam, but composite, that's a very different animal. And like you said, once you're there, in a clinical setting long enough to actually see your work fail, I don't think you appreciate how difficult bonding can be. Every step is super important. But I did a talk last fall at my local dental society meeting, and I put up a PowerPoint, and it was basically a poll about what people knew about their bonding agents. And I wasn't amazed because I knew this, but there were some numbers there. 23% did not know the name of their bond. It's just whatever their assistant gave them or whatever the guy that they bought their practice from used. And that just blows my mind. Never mind knowing the directions. Jerry Kugel from TUS famously said, know your directions. It's the number one problem in dentistry. People don't read their directions. If you're using duct tape at your house, that's one thing. But if you're putting adhesive dentistry into somebody's mouth and you're really relying on that chemistry to work the way that it was designed to work, you should know how to use it very well and execute it in that manner. And I just know it's not being done. The difference between how you air dry a 4th generation and a 7th generation are completely different. But to the average dentist, it's just bond. It's just glue.
You know who set my mind straight as an arrow on bonding and following the directions? I was at Ultradent. Dan Fisher and John Kanka were lecturing, and John Kanka took a bunch of us into the room, and he said he had extracted teeth, and he said, okay, let's do this bonding agent. And it says scrub it for 10 seconds. And then this one we're going to scrub for 5 seconds. And this one we're going to scrub for 10 seconds. And we did it. And the one that you scrubbed just half the amount of time the direction said, it was a horrible bond. It was just like, oh my God, are you kidding me? And I really think one of the signs of a serious bondodontist, which by the way, bondodontist started out as a slang term when they started coming out with these adhesive materials back in the 80s, the people who would do bonding, like, oh yeah, he's some Yahoo bondodontist. It was a very slang derogatory word, but the really elite adhesive dentist, they have a timer. So when it says, scrub for 15 seconds, the assistant hits the deal, and you sit there and you scrub for 15 seconds. And you're right. I mean, Michael Miller of Reality used to always say that. And I remember listening to Michael Miller of Reality out of Houston, talking to Gordon Christian, CRA at a Provo, and they were talking, they said, you could double the quality of dentistry in America if these dentists would just follow the damn instructions. And then their ego takes over. Well, they say, well, I like the adhesive of this company, but I like the resin of this company. It's like, dude, are you an organic chemist? I mean, do you really think 3M and Ivoclar made this adhesive to go with that resin? And but they just think they know it all, and they don't know. They're not organic chemists. No. When's the last time you met a dentist who had a PhD in organic chemistry?
I do know somebody, but
Do you?
Other than him, nobody.
Other than who? Oh, that one guy. Yeah. So the bottom line is, you just follow the damn instructions, and if it says 15 seconds, they didn't pull that number out of a hat.
Absolutely. I think our ego does get in the way, and I think our busy lives get in the way, and we take it for granted that what we're doing is just so important. It's the interface between the human body and what we're doing, the artificial entity. That has to be perfect. I mean, forget about curing and depth curing and bulk curing and nanocomposites. I mean, all that's important. Know your bonding, because you can screw up the rest and maybe be okay. You can't screw up the bond.
I'll tell you another story I witnessed one time. It was the founder of Tulsa Dental Products, Ben Johnson, an endodontist in Tulsa. And I was up there at Gordon's doing one of his 2-day classes, and he had just come out with Thermophil. And he was up there showing it to Rella and Gordon. And Rella, she said, look, you need to go back home. You see these instructions you have? It's dead on arrival. She goes, the most important thing you're ever going to do is make a laminated card with the pictures and the steps. She goes, nail the instruction card first. And Ben took that to heart, and he took that serious as a heart attack, that, the instructions, everything. So I know what all my homies are thinking. They say, okay, obviously, if adhesives of your gig, they all want to know, what do you use and why? What's your favorite adhesives?
I love this question.
I'm old school. I still just dump Elmer's glue in there, then plug it with amalgam. Am I doing it right?
Well, next time I'm in Arizona and have a toothache, I might call somebody else. By the way, I was down there this weekend. I saw you, but you're such a popular guy. I didn't want to interject.
Oh, dude, you should have come by the house. I wouldn't have any lobster, but I could have fed you some javelina and rattlesnake.
Well, I'll be back next I guess June for the next Mastery Summit, so I will reach out to you.
Yeah, absolutely.
So what bond do I use? OptiBond FL is number 1. And then really any of the universal adhesives. So I use Allbond from Bisco. I love Bisco products. Scotch Bond Universal is, that's probably the most popular by, the world's leading clinicians. Frank Spear, I believe, uses, well, I don't know if he practices anymore, but they teach Scotch Bond. Really any of the universal adhesives or any 4th generation. OptiBond FL has been a gold standard forever. Every time a new adhesive comes out, what is the gold standard? It's OptiBond FL or Clearfill SE. It's one of those two. So I like 6th generation, which is Clearfill SE. So it's really those 3 categories. 5th generation, like OptiBond Solo Plus, not a huge fan. And really 7th generation, your self-etch adhesives, garbage. And the literature supports.
You're talking over a lot of people's heads right now. Why don't you go back? You're in these generations. Why don't you start? Can you go through the generations? I mean, can you go 1, 2, 3, 4, 5, 6, 7, or 8, or 10, or what are we on now? 114.
I hope we get there. Hopefully, 114 is when you just put a filling in and it just cures itself. You walk away. Yeah. So the 1st, 2nd, and 3rd generations are more historic. They're I don't believe you can purchase them anymore. You might be able to find a third generation, but really fourth generation is when the total etch process started back in 1980. I believe Carrare's scientists figured out that if you etch dentin, you actually increase your dentin bond strengths. So your fourth generations are your three steps. You etch and rinse as one step. Your second is your primer, and that's really where you got to spend a lot of time scrubbing. That primer needs to be pushed into the tooth. So I always think to myself, I'm not just laying it on the tooth, I need to drive it in the tooth. So you can't over scrub. I do it twice as long as what the directions say. I don't get any sensitivity. I haven't been practicing long enough to say my technique's better than the next guy, but I do feel like I have a pretty solid handle on it. And I think it's in great part based upon how much I scrub. And then you air dry. And you need to air dry enough to get that solvent off the tooth. If that solvent is left on the tooth, you're going to leave voids, which can cause sensitivity. So we can talk about this later, but a dedicated air unit, so there's no water, no moisture coming out of that air water syringe tip, is really something I'm looking at changing in my practice. So you have the air drying step of the fourth generation bonding agents, and then you have the adhesive, which is essentially the glue. So fourth generation requires more adherence to the technique. So I think a lot of people that don't like fourth generation didn't follow the directions. They went to the fifth, which has a little bit more leniency in as far as its application, but its long-term bond strengths don't compare to the fourth generation. Your fourth generation has been around forever, and I don't think we're ever going to get away from it. It might be supplanted someday by generation 114, but the chemistry is separated. There's a reason why they did that in the beginning. They separated the chemistry because the bottles don't like mixing. So when you go to the fifth generation, you're taking two bottles and you're putting them together. Something has to give. OptiBond Solo Plus is a very common example. Prime and Bond NT by Dentsply. These are good bonding agents used by great clinicians. But if you're looking for something that's going to rival amalgam, you're going to want to keep the chemistry separate.
So what are the brands of the Total Etch then?
Total Etch OptiBond FL would be one.
From Kerr.
That's been the gold standard forever. Prime Q, I believe. I don't know if that's ultra dense adhesive, fourth generation adhesive. I don't know many more than OptiBond FL. A lot of them have died and given away to the succeeding generations. The fifth generation is so popular that I don't know any other fourth generations other than OptiBond FL.
So then what's Allbond from Bisco?
Allbond from Bisco is a universal adhesive. It hasn't been categorized as an eighth generation, but some people are calling those eighth generation bonding agents. And what's different with the universal is you can use them in any mode. You can total etch, you can selective etch, and you can do self etch. And the difference is there. It's whether you're etching or not, and if you do, it's where you etch. So your total etch, you're etching both dentin and enamel. Your selective etch is you're etching only the enamel. And then your self-etch mode, you're not etching the enamel at all. And study after study will show selective etch, regardless of the bonding agent, does not produce the same bond strengths as etching of enamel. So there's many ways to go about this. What I will say is there's something about universal adhesives that's very different, and it's something called MDP, which is it's a fancy chemical that really is changing how we do things because it covalently bonds to the tooth. As we probably all remember from dental school, the bonding protocol creates micromechanical retention, which is not an actual chemical bond, it's just Velcro essentially. Well, MDP, which is found in these universal adhesives, whether it's Scotch Bond or Allbond, has a chemical that will actually bind to the tooth structure itself. And that's gonna change things. We're actually creating a bond between the tooth and what we're putting in there. So we're seeing a lot better bond strengths with these universal adhesives. I'm just a little skeptical because they haven't been around for a long time. With that said, they're being studied every day, and they're becoming more and more popular in the circles of people that know what they're doing. Uh, we have a group out of, I believe, Sweden that studies everything about bonding. And the bonding protocol that I'm now going into, it might be complex. I recommend that people just get something and use the directions as long as it's not a 7th generation bonding agent. But if people want to do the best bonding technique, and I'd love to do, maybe a course on Dentaltown, or maybe post a blog with the technique, but I'll briefly go over it. It's using a 6th generation bonding agent, which has a self-etching primer. So the primer itself etches the dentin and the enamel, but you would do selective etch first. So selective etch of the enamel, then you use the self-etching primer of a 6th generation like Clearfill SE, and then you follow it up with the adhesive. And the guy that has been running this lab forever, he says that's what he would do if he was practicing dentistry today. Van Meerbeek is his name. If you read any article on bonding, he's in the reference section many times over. So he'd be a guy that I would really look up to, and that's the technique that he would recommend. With that said, it's probably a little bit more advanced. I think we can do great dentistry if we just follow directions.
Sometimes you got to wonder about dentists where, you have this amazing total etch, and the people with PhDs, organic chemistry, want to separate the etch, the primer, the adhesive, but you're a dentist, and the marketing says, well, let's just go one bottle. It reminds me of that movie. What was that movie where the guy said, I'm going to do the 6-minute abs. And then the psycho said 6-minute abs. The guy next to him says, what about 5-minute abs? And the guy just starts, something about Mary.
Something about Mary, yes.
And it's kind of like, come on, doc. I mean, you're doing a filling. Like you said, the control, or historically, was an amalgam that lasted 38 years on average. And really, you got to give something up just because you got to get rid of one step. They're doing it in files too. I hear a lot of endodontists bitching. It's like if you want to do your root canal with one file, why don't you just not do root canals? I mean, really, you can't change a file, because when you talk to an endodontist, usually they'll tell you that within one root canal, they might use 2 or 3 files from maybe 2 different companies. Sure. It's like they don't use just this file system on all their root canals. Sometimes when they're in MB2, they'll use this or that, and sometimes to go faster, easier, it ends up being lower quality.
Absolutely.
And I'm starting to wonder, and that's why I got a pit in my stomach whenever I hear someone talking about bulk fill, because the reason amalgam works so well is because when it's set up, it corroded, and the corrosion made the seal better and better. So it's really expanding from corrosion, whereas all composites shrink. And it's like, when I see these, if shrinking is the problem, so really you gotta bulk fill it. I mean, how could bulk fill be a great idea? I mean, just at the macro science of it. Are you a bulk fill fan?
I am not. I'm a fan of what's been tried and true for at least 10 years. And I try to stick to that. I'm deviating a little bit with my Bisco universal bond that hasn't been around for a long time, but the chemistry comes from things that have been used for a long time. They just added the MDP in there, which allows that covalent bond to occur. When it comes to bulk fill, something has to give. I do see a day when they'll find out a chemistry where, as the monomers polymerize, it'll actually expand.
That's
I can't imagine.
Boom.
Bisco better be working on it. So bulk fill to me is just, it's a marketing answer. It's not a scientific answer. And I hear dentists all the time saying, I'm trying this new product, and you ask why. Well, my rep said it's the best thing. I mean, come on, you're letting and nothing against reps. I have some great reps, but they don't have the background that we have. We should be able to make a decision on our own based upon the science, not based upon what's most popular. And the most popular products in dentistry are not the best. You look in Gordon Christensen's CRA report, he loves talking about what's popular, and it surprises me because he seems scientific. I don't care what's most popular. I care what's best. And listening to reps and companies and advertisements is not the way to go. Understand what's going on, or stick to something that somebody that does know what's going on, what do they use? You know, look at your Mike Malones and say, what are you using? And then just use it and follow directions. You're going to be fine. But if you're going to start going out on a limb and using a product without any sort of solid recommendation, you better understand what you're doing, or you're just not serving your patients well. And I think, you know, we owe it to our patients to really be knowledgeable about the one thing that we have to do, and it's that interface between the body and whatever we put in there.
You know what I wish you'd write a blog on? That is exactly why we started the Townie Choice Award, like, you know, in 1998. So, you know, there's so much noise and marketing, and a lot of times you don't know who's paying the speaker at your local dental society. And so I thought, well, let's have the dentist vote. You got to be a dentist, you got to vote. And I've always thought what the dentist voted on, and Gordon's told me the same thing, goes, you know, you can't fool thousands of dentists with 8 to 12 years of college. I wish you would go through, that'd be an amazing article, is go through what the townies actually voted on adhesive dentistry over the last several years, and say, did the collective wisdom of the dentists, because it's not like what's the most famous movie to win the Grammys or the Oscar or music or whatever. I mean, these are, every person voting is a doctor, you know,
Right.
And that's a huge wall to jump over. I'd be interested of what you thought if the townies actually got it right, in your opinion, over, say, the last 5, 10, or from the day one.
I'm on there all the time. I think.
Have you ever looked at which adhesives they voted on from year to year to year and how it's changed?
Henke's products are really up there, and I think that's because he was active on Dentaltown for a long time. I don't know if he still is, but you just hear his name come up a lot. And I don't use his products. I do know the science behind it's very sound. It's just not something that's come across my radar screen. But his stuff's very good. And then, you know, everything that I was saying earlier, OptiBond FL comes up all the time because it's a gold standard. You know, most people that comment on Dentaltown and read Dentaltown are just better dentists. And kudos to you for putting that together. But I go, you know, I'll be working on a patient. I have a question. I go to Dentaltown. I mean, I have textbooks, but once you go through Dentaltown enough, you know how to understand when somebody that knows what they're talking about. It's no different than when you go online. You know, you have if your mother has a lump on her knee. I mean, as a doctor, I'm going to go online, and I just, you know, I'm discriminate. On Dentaltown, most of the stuff's good. Not everything's great, but you get a general sense of what works and what doesn't work. And I do think the townies would have it right. Absolutely.
I just think it's so mind-boggling. If you'd have told me when I graduated from dental school that one day I'd have 250,000 dentists in my pocket. I mean, that's Star Wars shit when you're 54. I mean, I did not see that coming. I didn't see the ATM coming, the cell phone. I didn't see any of this coming. And
Sure.
We just have to sit back and thank Al Gore for inventing the internet.
Absolutely.
I mean, and but yeah, I and what I also like about the townies is the human. Well, first of all, the human mind condition. I think they just want to believe what they want to believe. It starts with, what do you want to believe? And then they start with what they want to believe, and then they work back from there. And it's the scientific mind who doesn't have a dog in the game, who just says, well, what's the science? We're going to follow the science, it's not a wishing well. It's a science. And sometimes the science says that you're making a very bad decision, and you say rats because I really wanted that to be a great idea, and it's not. And that's what separates a dentist, a doctor, a scientist from the general public. Is I don't care what you want to believe. I don't care that you think bulk fill will last longer than amalgam. The data is clear, very clear, that your average amalgam is lasting 38 years, and your average direct posterior composite is lasting 6.5. That's where we have to start. And you can't even get 90% of the dentists to start there. They're like, well, my composite lasts longer than amalgam. Okay, so what is, you know what I mean? It's like, you can't even have a conversation. That's why I like the other study where I'm trying to get the insurance CEOs to share more of their claims data, because whenever you get a peek at it, and I lectured to a group of insurance CEOs in Florida last year, but like take endo. When you look at 100 million claims filed for molar endo, if a general dentist does it, in just 60 months, 10% of those teeth are extracted. If an endodontist does it, 60 months later, 5% of the teeth are extracted. Go to any dentist. What percent of your root canals have to be extracted? Well, you know, knock on wood, knock on wood, it's never happened, Howie. It's like, okay, you want to believe that.
Right.
And you do, and it's just I love ugly, gross facts. I mean, did anyone ever think when they sat down and did 10 molar root canals in a week that in 5 years 10% of them would be extracted? And then you got to ask yourself, well, they ended honest. That's all they do, and they still get 5% extracted in 5 years. So what is that? Did they not do the final restoration? That was one of the lessons I learned in the beginning. That you'd say need a root canal and a crown. Well, I can't afford the crown, so let's just do the root canal for now. And then 5 years later, you're extracting this mush ball tooth where they never, so if you can't afford the root canal and the crown, then let's not do it.
Absolutely. We as humans have cognitive dissonance. When it comes to big data, that was a term that I came across this past weekend. Just like you said, if we had the data from the insurance companies, that would fall under the category of big data. You can't argue with that. But like you said, very, very small N value of a practitioner in rural Maine. Yeah, I mean, we fall into this trap of we are better than the average. But we can't argue the science, and that's your point. And I love that you're bringing that up. That was the one thing I took away from my dental school education. They really, really drove that point home. Things need to be evidence-based in science. Don't think that you know any different just based upon what you see in your little small world. So we need to continue with that, and we need to continue educating ourselves through continuing education. And this is why we're meeting today. We're talking about this fact that 20% of dentists only take the minimum requirement. I bet that number is probably higher, whatever the state board requirements are. I run into people all the time. What are you doing this weekend? Oh, I'm going to CE. Oh, I got my 40 credits already. Really? You don't feel like you need to improve upon something that you do? What kind of bonding agent do you use, by the way? Oh, something, it's blue, it's got a black cap. Okay, well, maybe you should be taking some more CE. I'm very passionate about this concept, and I don't mean to speak ill of my brothers in the profession, but we need to do better. I think medicine needs to do better. I go to my own primary care practitioner, and sometimes they don't know what they're doing. But that's true in any profession. I think what we need to do is always try to be better, try to learn more, and try to improve upon our craft.
I want to ask you a politically incorrect question. A lot of the young dentists tell me that they don't know what to do because they want to go back to their small town in Beaumont, Texas, and that's where they live. And then they got a job with the old man that was a dentist when they were in grammar school. And it's a group practice with like 3 guys in there, and like one of them's like just really bad, and they're like, he's still spinning Sargenti, and it's just really bad. And then another guy's like, okay, what do you? And some of it's even worse because she's 25 and she's working for her dad, and she grew up thinking her dad was all that and walked on water, and now she's a doctor, and she's like, oh my God, Dad, someone should restrict Dad from doing posterior composites and endo. You're in a group practice, right?
I own a practice that's growing. I have 1 associate right now. I just hired a recent grad, and we'll be hiring 1 other experienced doctor. So we're converting to a 4-doctor practice.
But it's not 4 partners. It's just you're the 400-pound girl and their associates.
Correct.
So there's a chain of command. What do you do when there's no chain of command and you go back and you're working with your dad and he's got another partner and you're 25 and you think your dad is a bad dentist and another partner is good on extractions but horrible on posterior composites, and what would you advise her?
Well, for that person that has a parent that's a dentist, I would recommend going to an AEGD program or a GPR. Do a year after dental school. And it was the best thing that I did. The dentists that I've met that have done that just understand things so much better. You graduate after 2 years of pretend practice dentistry. You don't know how to treatment plan. You don't really know how to do much. You were just trying to get your requirements fulfilled. It's a different mindset. When you do a residency, you're underneath the supervision of some really good dentists. At least in my program, I had some really good instructors. They teach you how to think differently. If you go work for your dad, he's been doing the same thing for 25 years. He's on cruise control, and that cruise control mentality can become contagious. And there's several practices in the area where everybody's in cruise control. And you see new dentists that start working for them, and they're on cruise control, and they're only 2-3 years out. I think an AEGD and a MasterTrack program, or really just dedicating yourself to CE to some degree, will just keep you out of that rut before it should happen. You know, if you're 5 years from retirement and you don't want to learn all the newest and greatest, I could understand that. But starting dentistry, you really should start to pick the brains of the people around you. Like you said, we're a composite of our 5 closest people. Absolutely. So find a mentor, do an AEGD, do a MasterTrack program. I don't recommend doing Spear and Coyce and all those guys until you've been, in the trenches for a while. We have some guys in the area that really feel they need to start doing that now. It's like, well, no, get good at the basics first before you start learning the advanced stuff. And I think Spear and Coyce have single-handedly changed how I do dentistry, but I didn't start doing it until 2 years ago, and I'm not sure I would have had the return on investment had I done it 2 years out of school. Even though at that time I thought I knew enough, I just didn't have the money to do it. Now that I do, I'm glad I didn't do it 2 years out, because it would have been a waste of money. They would have been talking way over my head. So keep it simple and learn the basics. I can't stress that enough, that a Class 2 composite, I think, is one of the hardest things that we do. Getting a good contact and not allowing that thing to leak. That's very difficult. Get good at that. Get good at extractions. Dentists that refer simple extractions, I mean, it blows my mind. We went to school to be doctors. Let's act like it. I think it all comes down to treating our patients with the best care possible. And I think for us to be good clinicians, we have to do some of the more difficult cases. We have to get outside our comfort zone enough so we can treatment plan accordingly. I mean, I've heard you talk on your podcast about the fact that if you do Invisalign, you refer more Invisalign. You do endo, you send more endo. That's because you're learning how to struggle through the procedure to the point that you understand its value. And if you understand its value when you're going through a complex treatment plan, you're more likely to give that patient what they need. And I think that's difficult for a lot of people to understand. Not that we all need to be super dentists, but we need to be super treatment planners. And I think the mastership in the Academy of General Dentistry is one way to become a super treatment planner. And I think we owe that to our patients.
What you said was profound. My dental office just happens to be just up the street from the Arizona Cardinals headquarters and facilities. And over the years, I've talked to so many of their coaches and assistant coaches and head coaches, running into them all around Ahwatukee. And when they always say that when they lose a big game, like, oh, so what happened? They said it always comes down to 4 things. Someone, it was a pass, a catch, a block, a tackle. So the reason we didn't score is because someone missed a basic block. Someone missed a basic tackle. Someone didn't catch a ball that hit him between the numbers on his jersey. And before you go learn all these complicated flea flicker plays at Panky and Coyce and Spear and all this stuff, do you have down your pass, your catch, your block, your tackle? Do you know the fundamentals? And when they lose a game 40-0, they don't come back and teaching some complicated play. They just come back 3 hours a day doing the basics. If you just can nail your basics. And the other thing about extractions, I don't like that either, when dentists don't do extraction, because you look at these public dental schools, and those are paid by the taxpayers. And half that money comes from rural America, and most of those doctors went to public dental schools, and they're sending a kid back to rural America. A dentist will say, well, I have $350,000 student loans. Dude, in a public dental school, your tuition didn't cover 25% of the cost of that dental school university. So the taxpayer, the waitress at the Waffle House was picking up 3/4 of that tab, and the public dental school sent them back to rural America, and they don't know a basic root canal, basic Invisalign, a basic, and public health dentistry is one of the 9 specialties, and I call it the 9th specialty because it's the one no one talks about. And like, imagine going to the hospital with a broken leg, and some millennial said, well, we don't do broken legs. We just do broken fingers. We don't like bloody stuff. It's like, you're a doctor trained in a public dental school, going back to your community. You're the fireman. Imagine calling a fireman, and say, oh, the house is on fire. Oh, we don't do houses. We only do trailers and duplexes. And, oh, that's a 3-story building. Oh, our deal only goes up to, I mean, you're a fireman. There's a fire. I don't care if you want to go. I don't care if you have everything you need. I don't care if you wish you could make it a 5-alarm fire and have 5 other trucks show up. Dude, you're a fireman and there's a fire, and we're going to throw you on that fire and give it what you got. And when someone comes in with a toothache, you should be able to pull the damn tooth.
Absolutely. Do you know the story about Vince Lombardi when he first walked into the Packers locker room? I believe it was 1959. The team was atrocious, at best. And they hired this great coach, and he walked in, and the first words out of his mouth as he's holding up a football was, "This is a football." And the whole point of that concept is, let's get back to basics before we start talking about the complex things. Guess what? He's the best coach in history of football, behind Bill Belichick, of course, because I'm in New England. But before Bill, he was the best coach. So yeah, basics are where it starts. Let's not trick ourselves into thinking that it's not important, because it is.
But I think we can all agree that Vince Lombardi was the best coach, and the New England Patriots won the Super Bowl, but the Arizona Cardinals are the greatest football team in the history of football. I think we can all agree on that.
Of the Southeast Conference. Whatever conference they're in.
Yeah, you got to get back to basics. So I know what my homies are thinking. They're coming out of school and they're thinking, this MasterTrack program, I got student loans. I just got a job at Aspen. I mean, what does something like this cost? And do you think it's a return on investment?
Absolutely. There's, at least the New England MasterTrack program, there's nothing that compares to it. I can't speak for other MasterTrack programs, but I do know they're of the most affordable way to get continuing education credits. We charge $800 for 40 credits. I mean, that's you can go to Coyce and spend $10,000. You're not going to get any return on investment similar to that.
So how do you guys pull off? So 800 divided by 40 is $20 a credit hour. Dude, I can't eat at the Waffle House for $20. How do you pull that off?
That's just the way it's been. We have sponsors that we bring in. We set up booths, so the sponsors will help pay for the meals, some of the lodging. The speakers that we get, they average about $10,000 to $12,000 for the weekend, and we get 30 people all in the room together. The numbers work out. We have a nice budget. We've been doing this since 1991. So really, it just comes down to people being dedicated, paying the money, showing up, bringing in some reps, and just having a good time.
And you know what I wish we would also think about when we're talking about dental meetings, like go back and look at every meeting the Maine State Dental Association ever had. Like take California. There's about 19 different Delta Dentals. There's not one Delta Dental. There's Delta Dental of California, of Colorado, of all these dentals. Like Delta Dental of Colorado has sold $1 billion of dental insurance a year for decades. But the CEO's never been invited to speak at the CDA. So these guys have to go out on the front lines and get employers to buy dental insurance. And so they're subsidizing your trade, your craft, your surgery. And what is the dentist's response is? I can't believe you didn't pay for the whole damn thing. It's like, dude, well, why don't you go to her boss? Why don't you go to her boss and say, hey, cut me a check. This insurance you buy. I mean, all these companies have high overhead, and every insurance CEO tells me that when times are in a recession and going bad, one of the first things everybody wants to just drop is dental. And they're out there on the front lines, but the relationship on our value chain, like we have better relationships in dentists with Patterson and Shine and Benco and Burkhardt or 3M or Kerr or Danaher, Sirona Dentsply. Like when you go to the Sirona Dentsply deal, all their senior management's there, shaking hands with the dentist. I mean, you could go see everyone in management at the Sirona deal is there. But we would be such better dentists if our value chain would sit down and show us the data, the claims. It'd be so nice on these MasterTrack programs if the biggest dental insurance CEO would come in there and say, look, we want you to be better because when you do this crappy, We got to
Right.
pay for it again. I mean, they've got companies like Intel that they've insured for 25 years. The dental insurance companies don't like paying for rework. They don't like your root canal 3 years later to be at an endodontist and they got to pay it again. They have the most money at stake for you to be in the MasterTrack program. But when I talk to those dental CEOs, they don't like dentists because they think I do so much for you, and I've only heard from you 2 times in my life after sending you $100,000 a year for 10 years, and both times you sent me a letter with profanity in it. And I'm like, you arrogant little bastard. Why don't you go have the American Dental Association go sell $20 billion a year in dental insurance?
Right.
And most industries don't get a subsidy from the government or employer. Like when I buy my iPhone, the government doesn't chip in. No one subsidizes my iPhone, my house, my car. I mean, you think since I'm Irish, I'm a victim of my own genetics, and someone should at least pay for my beer, right? But so I wish the AGD, I wish all the MasterTrack programs would go to their local dental CEO, insurance CEOs, and say, we really wish our value chain worked more together because we're both serving the same person, the patient. And I can't think of anything that would want you to be a quality dentist more than the insurance company. And when I go into dental offices, I look at the revenue coming in, 50% of that money is coming in from insurance companies. 25% to the other 50% is just the patient's co-payments or the cash patient. So yeah, that would be a great long-term project for you to do. And if you could break the cherry in Maine, and then he could tell his other people that, come on, these guys, because it's emotional anchoring. I mean, if you're the Delta CEO of Arizona and there's almost 6,000 dentists, but maybe only 30 of them wrote you a nasty letter, you're only going to remember those 30. Then you're going to think we all think like that.
Well, we're going to have to get on board with them. This past weekend at the Mastery Summit, we talked a lot about where things are going in dentistry. Back in the 90s when managed care and medicine came out, things change, and now look at them. It's an insurance-based industry. Well, dentistry is not going to be far behind. Pharmacy, it went down that road, optometry. Everything's going to a bottom dollar model, and insurance is going to be part of that. So we have to fight for our profession and for our patients to make sure that we're able to do quality care. And like you said, I'm sure the insurance companies would love for us to do quality care. We're just not talking together, because it's a bad word, PPO. Well, get over it. It's here to stay. It's not going to change. So yeah, we need to hold hands with them across the aisle and make sure that we're, doing the best for the patient.
You're up there in Maine, and my vision of Maine is that it's a big forest. It's a lot of rural areas. Do you know many rural dentists up there that don't participate with any insurance? Or is it very common? Or do most people take your Deltas and Blue Cross Blue Shields? And
for the most part, those in the rural settings take what the patients need. As you get closer to the big towns like Portland, it becomes much less, depending on the quality of work that you're providing. I'm on the outskirts. I don't have a choice. All my patients demand it. And I'm getting ready for the future. If you drop a PPO now, guess what? Those patients are going to go somewhere else that accepts them. And as soon as you're going to be required to do it, you just lost that patient for a lifetime. So we're learning how to play the game now. So the future will be much better for us than the guy down the road that may not want to partake in that.
And I've seen this rodeo in 20 different countries, but a lot of them, like say, when the government program, the fees are just getting low, the dentists all gravitate towards things that are fee for service. So they use their insurance base, but they're pulling fee for service Invisalign or placing dental implants or sleep apnea. So it's kind of like a grocery store doesn't make any money selling bread and milk. They know that when you walk in the front door, you want bread and milk. So they put the bread clear in this back corner. And then you got to go to the other corner to get the milk. And they're trying to get you to walk through frozen where everything is such a ripoff. They don't make money on They lose money on produce because of produce going bad. Cans and boxes are pretty much at margin or cost, but frozen, you ever notice the aisles in the frozen are twice as wide, 3 times as wide? They would never want you to look down that aisle, see a traffic jam, and then walk to the next aisle. You know, so that's like, if you, so in dentistry, maybe the milk and bread and the canned and the box might be a lot of these insurance PPOs, but a lot of dentists are saying, I don't care about this big PPO practice because I'm doing an Invisalign case every week. I'm placing a dental implant every week, and that I'm charging top dollar, you know?
Sure. Well, we're going to have to learn how to do it all, unfortunately. I mean, whether you refer or not, that's fine. But we have to learn how to play the game. And I hate saying that. But if you just look at all the professions around us, it's happening. And it's happening fast. I mean, medicine now, I remember my doctor, he was the same doctor my mom had. Now you can't find a doctor that stays in the same place more than 3 years. He's off to the next place because the insurance companies make it miserable. And we live in a free market. Guess what's going to happen? Dentistry is going to be following suit. You know, that's my feeling, and I think a lot of it was echoed this past weekend down in Phoenix. So
it's over an hour. Can you just stay for a couple more minutes? I know you got patience.
Absolutely.
A lot of these young kids, just the high dollar things, they come out of school $350,000 in debt. And so the question is, do I need to buy a $150,000 CAD cam to be a good dentist?
Absolutely not. You know, there's actually some studies coming out now that show, you know, unless you're doing more than, say, 25, 30 units a month, it really doesn't make sense. And when the rep comes in, you know, all he's doing is taking your lab bill and extrapolating it out and saying, oh, you just need to do 10 units a month. Well, there's a lot more that goes into it. All that dead chair time while the patient's sitting in the chair while it's being milled needs to be accounted for. Whether your scanner has a license fee, you have to pay the license fee every time you scan because it's owned by the same company that sells impression material, and they obviously want to recoup their costs. So there's a lot more that goes into it. You know, I got a cone beam. I didn't go buy a nice car. I bought a cone beam. So, you know, it really comes down to what your values are. I wanted to enjoy dentistry, and I feel like a cone beam, if you're placing implants, is imperative. But no, you don't need to go buy the expensive stuff.
What cone beam did you buy?
Instrumentarium. They're owned by Cavo Kerr. I believe they're owned by.
Do you have a CAD cam?
Not yet. The math isn't working for me yet. Once we go to a 4-doctor practice, I'm going to look at it again. I think the technology is there, but I think adhesive dentistry is very difficult to do. And if you're going to be relying on bonding restorations, you better know what you're doing. So I need to calibrate my staff, make sure they know what they're doing. So it's going to be a well thought out plan. When I get one, I do see getting one the next 5 years, though.
Last question, laser.
Laser, wow. We should do a separate podcast on that. Diode, absolutely. If you're going to get a hard tissue laser and you want to prep teeth with it, I would highly recommend the Solea. I had it for 9 months. I ended up returning it. Not because I didn't like it. I'm just too used to doing things the way I've been doing it for 10 years. If you're right out of school and you want to market yourself as the laser dentist and build your practice around that machine, absolutely. I think that would be a good return on investment. But for somebody who's got a busy practice, I'm already booking out far enough. Why am I going to add another toy that does the same thing I'm already doing?
Hey, when I come out and see you someday, I want to eat your finest lobster. And next time you're in Arizona, I'll buy you dinner at the what's my rattlesnake place. I'll buy you dinner at Rustler's Roost. It's only like 5 blocks from Dentaltown, so it's like 3 miles from my house, and I'll feed you some Arizona rattlesnake.
Great. Well, I've decided I'm going to move there because it was so beautiful. The 4 days we were there, I saw all of 0 clouds. So
Are you seriously going to move to Phoenix?
Someday, 30 years from now. So you'll still be around. There's no way you're going anywhere. So we'll have to sit over a beer and some lobster. I'll bring lobster out with me. Okay.
Well, seriously, congratulations on your FAGD, your involvement in the Maine Academy of General Dentistry, your MasterTrack program. It's guys like you that are dentistry's 1,000 points of light, and that's I commend you for all that you've done for dentistry, for Dentaltown, and I hope someday you grace us with building us an online CE course on adhesive dentistry or write an article for Dentaltown magazine. I think that would be amazing.
Absolutely. I will work on it. I just wanted to leave everybody with the website, how to find out where their local MasterTrack program is. It's agd.org. And what I would do is type in MasterTrack in the search field in the upper right corner of the website. And it's all one word, MasterTrack. And you'll find a list of there's 21 of them. They're all over the country.
And again, getting my FAGD and MAGD was the best move I ever made. And a lot of it was, they say your net worth is equal to your network. And when you switch out your 5 dentists with 5 guys going for their FAGD, MAGD, they're pulling you along. I mean, they're texting you on a Friday night at 10 o'clock, ask with dental questions. I mean, I got so many MAGD, FAGD guys texting me pano x-rays on my iPhone on a Friday night. I mean, you're just always in the game if you're playing with 5 guys. Like everybody always talks about Michael Jordan. I'm pretty sure there were 4 other amazing guys on that floor. I mean, they had the best rebounder in the world. They had the best point guard. I mean, so yeah, go to the AGD and say, I'm going to upgrade all my dental friends to people going for it. And if you do that, dentistry will be easy and fun.
Right. Well, Howard, thank you for everything you've done. I'm a better dentist today because of you. So
thanks, buddy. All right. Have a rocking hot day.
Sounds good. We'll see you in a year.